Hello, today's topic of discussion is microbubble contrast agents. This is a very important and basic topic for USG physics. Microbubble contrast agents, they are basically the contrast agent used in ultrasound. They are in the form of a bubble or a microbubble. That's why they are known as microbubble contrast agent. They are contrast agents because they are enhancing the contrast. Microbubble contrast agents. Let us understand about their physics, what are they made up of, and what is the basic mechanism of a microbubble contrast agent. So, first of all, we should know that why we are using these USG contrast agents, since we already have CT and MR contrast agents. We are using these USG contrast agent is basically because they are giving you a real time picture. When we are doing CT or MR, we need contrast to better delineate our normal structure and the pathology. But in CT and MR contrast agent, there are still some limitations. So, what are those limitations? Because they are not giving you a real-time picture while USG contrast agents are giving you a real-time picture. Second important thing is they are providing you a much higher temporal resolution. Temporal resolution is nothing but whenever a structure is moving like heart, so the ability to differentiate two moving structures clearly gives you a good temporal resolution. So when we use USG contrast agent, the temporal resolution is much higher. Third important point for USG contrast agent that they have a good enhancement dynamics. Fourth important thing in a USG contrast agent that they don't need a predefined scan time while we need a predefined scan time in CT and MR contrast agent. Fifth most important thing is excellent tolerance. We know that CT and MR contrast agents, CT contrast agents are ionizing and non-ionizing, while in MR contrast agent we use gadolinium. So before giving a CT contrast agent, we need to check the KFT of the patient. While when we give USG contrast agent and they are made up of air only and some shell, their tolerance is much better compared to these agents, and there is no predefined KFT and other things to be checked. Next important thing is no nephrotoxicity. No nephrotoxicity is because they are microbubbles. They excrete through lung, so there is no nephrotoxicity as well, and no severe hypersensitivity reaction as USG contrast agent is because their excretion is with the help of lungs, and till now the reports for hypersensitivity reaction in USG contrast agent is much less than compared to CT and MR. Now, why we need and what are the basic requirements of a USG contrast agent? First important thing that it should be safe, because we already have CT and MR contrast agent. When we know that there are some hypersensitivity reaction with CT and MR and we need to check KFT and other requirements are also while giving the CT and MR contrast agent, then what is the need to give a USG contrast agent if it's not safe at all? So it should be safe. Second important thing that it should be metabolically inert as well. It should be given like we are having a normal salines. It should be drink and then should come out of our normal physiology of the body. So it should be metabolically inert and long lasting also. Why long lasting? Long lasting because suppose you are giving IV contrast agent, so it should be in the system for a certain period of time, so that the contrast enhanced dynamic should be with these contrast agents, so that we are able to visualize or delineate the picture very well. And fourth important thing is strong reflector of ultrasound. We are going to study how this contrast dynamics exactly work on the basis of ultrasound. So if it is not a strong reflector of ultrasound, then what is the use of these USG contrast agents? So it should better reflect the ultrasound waves as well, and should be small enough to pass the capillaries. USG contrast agents are basically intravascular contrast agents, while these CT and MR contrast agents are extravascular contrast agents. So they should be small enough to pass the capillaries, and they should go to the place where they are actually needed. Suppose we are going to do USG contrast agent to see the ventricular wall or ventricular wall motion abnormalities. So when we are giving them IV, they should go and connect inside the ventricles so that we are able to see them. So now let us see what is basically the structure of a microbubble contrast agent. As I already told you, that is a microbubble. Since it is a microbubble, it is round in shape, and they are basically made up of gases. Question arises, why only gases are used to have a USG contrast agent, and why there is a need of a shell around it. As we are seeing in this picture, this is a shell, and inside the shell there is gas. Because suppose uh, we have a normal saline, and you all know that during your childhood time you have also done that activity, that when you are trying to make bubble from a glass full of normal saline, but after some time what happens, these bubble burst. So to maintain their delicacy, we should need a shell around them. Now the question arises, what shell and what is the material this shell is made up of? So basically we have three type of shell: lipid shell, protein shell, and polymer shell. So in the inside there is gas. It can be the perfluorocarbon, nitrogen, as well as air. The size of these microbubble contrast agent ranges from 1 to 10 micron. These lipid shell, protein shell, and polymer shell, why we are using these three materials? Because they are delicate enough, they are not that much strong, and they are not much that weak. They can resonate with the ultrasound harmonics. That's why we are using lipid shell, protein shell, or polymer shell. Suppose we use a rigid shell, what happens? The microbubble which we are using for contrast, it will not be able to get contract or relaxed, because the shell around them will be rigid. And if we use a very much delicate structure, they will burst out. So we should use something in between. So that's why we are using lipid shell, protein shell, and polymer shell. Now how do we prepare these USG contrast agents? The basic contrast agent we use is SonoView. SonoView is a common contrast agent used in USG. This is how it is available in the market. This is a mini spike system. This is the syringe which is available with this mini spike system. This is the vial which contains the powder, and these powders are nothing but the microbubble contrast agents. And now we will learn how we reconstitute it and then give IV these contrast agents. Moving further on the next slide. This is nothing but a mini spike transfer system. As I already told you that vial consists of the powder, and powders are basically the microbubble contrast agent. We already have some normal saline which is already present in this mini spike transfer system. So we put it inside it and then shake it, and then we prepare this. What we do, this mini spike transfer system, we attach the syringe on the top of it. Then we shake it, and finally after reconstituting it, we can take it back inside the syringe, and now the syringe is prepared to give IV. This is how we prepare this USG contrast agent, these microbubble contrast agent. So till now we learned that what is a microbubble contrast agent, what is its shape, which material they are made up of from, and why do we need those material, why it is made of lipid polymer, and why the inside is made up of air, and how is a mini spike transfer system is formed, and why we are giving them IV, and they are basically the intravascular contrast agent, why they are better than CT and MR contrast agent, and how and what should be an ideal USG contrast agent. In the next part, we'll learn about the dynamics or the contrast dynamics or the contrast physics behind it. Thank you.